Okay.
Hi guys, so basically today in this presentation, in this meeting, we'll be talking about our research topic, which was cross-cultural study on perceived violence against healthcare workers. Personally speaking, I learned a lot through this research project, and sometimes it's at some places even I was shocked about the results that we got. What did you guys learn from this?
I learned how different every single country is, but yet there's also some similarities between the three, but it's like very minimal. And it's very interesting to see how different everything is for everybody else.
As Andy said, it's really different. I mean, I was personally curious to look how the results will be, how the interviews will be, like how we will carry out the meetings we will be keeping. So overall, I was like curious and looking forward to these.
Menchi, what did you learn?
Yeah, about I can learn about how they do prevention and pandemic prevention and control. And I learned that, like Annalise said, that every country has difference, but it's not much. It's not big different.
Yes. Moving on, guys. The aim of our research was to get an insight into cross-cultural dimension of perceived violence. Now, actually, we got a lot of information about the two countries. The information was very striking. It was very different from what we expected. We'll talk about it in the results section. Let's first talk about the objective of our research paper. The objective was CPR. We try to keep it, keep the mnemonic very known to us so that it becomes easy for us to memorize. I actually gave myself a pat on the back for coming up with it. So CPR, C stands for comparison and cause. Yes, we got a comparison study between Vietnam and India. We couldn't get one for the US because US did not have ethical consideration. Apart from the research thingy, I actually learned a lot to manage between the different time zones, to coordinate with people, and it was pretty fun, pretty pressurizing and hectic, but fun. Next, we learned about the protective measures. We talked to doctors, and we got to know their perspective about what should the government do, what should the people do to protect them from violence. And lastly, we learned about research and reasoning. Okay. Moving on, our proposed methodology was conducting short, unstructured, and open-ended interviews with the healthcare workers. We have conducted 7 interviews so far from both of the countries. And Charanpreet and Minchi, you guys conducted the interviews. What do you have to say about this? What did you learn from this?
So before conducting the interviews, I had this thought that I'll have to be more patient. I'll have to be more, like I'll have to have a good rapport building with them. But it wasn't like that. I mean, it went very smoothly. The doctors, they were like waiting for us to call, as Shubh said earlier. So they were very much happy to know that, okay, fine, I'm conducting an interview. There's these things which I'll be asking them. So while conducting the interview, doctors, they were easily sharing their experiences, easily saying about what should be done and what shouldn't be done, what people they can start, taking care of, even small things, respect. It's a very small thing. I mean, you can respect them, instead of talking in a harsh way, you can talk them in a polite way. So that's what I learned through interviews.
Minchi, what did you learn from the interviews?
Well, the first thing I have to say that I am kind of surprised at how they are willing to, to join in the pandemic protection and control. And 4 out of 5 of the people who I interviewed are students. Yeah, just only one doctor. And they just like they are so willing to join, and they feel helpful when they can help people. All of them have heard about violence against healthcare workers, but they haven't been in any situation like that.
Yeah, that is true. That's true, Minji. It was very surprising to see that Vietnamese people, the doctors and students, they love to take initiative to serve the society. They actually do things for the good, and they're very brave in this manner. Next, talking about the results that we expected were very different. It seemed like the Indian doctors were trying to vent out. They wanted a hearing here, they wanted somebody to listen to their rants, and that is what exactly happened. So basically, the Indian doctors say that they feel humiliated at times, they feel insulted, and they should not be accountable for it because sometimes it's not their fault. In India, the government infrastructure doesn't function that well. So if there is any shortage of equipments, let's say ventilators or beds, the government should be held accountable for that. The hospital should be held accountable. But it is actually the doctors who get all the blame and who are subjected to violence. What do you have to say about this, Annalise? Do you think it's the same case in America?
I don't think it's 100% the same. I feel like it's like right in the middle between both Vietnam and India. I feel like we have plenty of abuse, but probably not as much that is shown as India compared to us. I feel like the US is all the abuse that they might feel like not everybody hears about it. Like it's not very talked about. And if it's not very talked about, I feel like it's not a huge thing. So I'm guessing like a lot of it doesn't happen as much. It probably happens enough, but not maybe as much as India, where a lot of people actually know about it and hear about it.
Yeah. I mean, what did you learn from it?
Well, so it's kind of difficult to say because I haven't been in any pandemic prevention and control team. But I think that when there's something happen to my country, such as the pandemic, I think that I should join a volunteer team. Yeah, really, because everyone around me, all of them, they all join a local team to help the people, and I think that's amazing.
I love that through this research you feel inspired to go for volunteering work. That's amazing. This is one of the real life impact that we did not expect to see, and I'm so happy for that. Next, moving on to Vietnamese result. I was actually surprised to see that Vietnamese do not have much instances about violence against the healthcare workers. And Vietnamese, I would say the Japanese, all the East Asian countries, they pay a lot of attention to their human resource. So the government officials, the hospitals, the organizations are actually accountable for whatever happens, whatever wrong happens in the among the doctors and with the patients. And surprisingly, the doctors are given really well treatment, because I was reading the interviews and I realized that some of the people said that joining a prevention program was actually fun because they felt like a family. They felt that it was very fun, it was very sociable and very home-like feeling. So I think that is something that encourages them to participate more, to serve people, and this also brings respect to them, right? Annalise, what do you have to say about it?
I thought it was really interesting to find out this information because it kind of blows my mind how much respect is brought for healthcare workers. Like we show respect here, but I'm guessing in Vietnam it's like the utmost respect that they have there.
Yeah.
I'm sorry, there's a train behind me. But it really blew my mind that it's crazy how much respect you can have for somebody, because I feel like that's really rare in the US to have respect. It just depends on who the person is. So that it really honestly blew my mind to see the Vietnam results.
Yeah. Charanpreet, yeah, Minchi, add something?
Yeah, I mean that normally I still read or I still hear about some story about violence against healthcare workers in my countries. Yeah, it's still have it, but during the pandemic is like everyone I interviewed that they all say that they just heard about that, but they didn't in the situation.
Now for like country like India, where like I mean if you ask anyone, like have you ever heard or have you ever seen any doctors or any healthcare workers getting abused physically or verbally? Everyone will be like, yes, I have. I mean, there's not a single one who will say that no. I mean, everyone, they know that yes, these things keep on happening. And while I was conducting an interview, she was a gynec, and she being a gynec, she says that I am just responsible for certain things. I don't know what other, like if any heart patient comes to me, I don't know what to do. So the people here, I guess, yeah, in India, there should be more encouragement of education. People who are not educated enough, they feel that every doctors they are same. Every doctors have certain basic things to do. I mean, they have certain basic things to do, but you can't expect them to perform all surgeries. There's a differentiation given to them. That's the reason why they are called a specialist for certain areas. While I would say that people in India, they are more emotionally attached. I mean, if the surgery goes well, if one of the family member returns well from the surgery, they'll keep they'll say doctors are God. I mean, they'll worship doctors as God. They'll be very happy. Uh, they'll give everything. But when it comes to losing someone, they won't realize that okay, it's fine. I have lost someone, it's fine. I mean, instead of in going through that sadness, they'll start, abusing them. They'll start being physical, which is not right. So people, they should start respecting them. People should feel that they are not just a doctor. They she may be a wife, he may be a husband, she may be a daughter, he may be a son. So apart from having a role of a doctor, they have a role of different positions in the family and the society.
Yeah, I mean, I actually agree to the part where you said that the emotion overpowers people, the patients, and they lose their rationality. You cannot expect a person to be something all the time. You cannot expect me to be a student all the time. I have a life too. You cannot expect me to go to movies with my textbook and read under the dark just because I'm a student. I have different things to do. Similarly, even doctors do that, right? So that's pretty. Um, that's a little thing that people should understand these days. And to summarize all of it, guys, first let's talk about how was your experience throughout the research, and what did you guys feel about it?
So on a personal basis, I enjoyed taking interviews. I was nervous at first, like how will I go with it? I mean, the questions, like will I be able to, rapport build everything? But it was really nice. I enjoyed taking interviews. I enjoyed I mean, it wasn't just about taking the interviews. There was a lot of self-learning. I mean, after hearing them out, I feel like I'll be more genuine to them. I'll be more true to them. I mean, uh, there's a learning which we all are seeing in ourselves with this research. I mean, I'll start being more, respecting towards them. That's what I feel I start doing.
Annalise, what did you learn through it?
I learned that there is a lot of differences, but there's also plenty of similarities between the countries that like you don't hear about because nobody speaks about it. I also learned for like in the US, I wasn't able to do the interviews, but like looking up like different like research papers and different peer-reviewed articles, there is plenty of abuse that goes on in the US, but it's just not the first thing that you see on social media or anything like that because people don't think it's as important when really it should be, because it's definitely something that we should fix and show respect for those who take their time out of their days and their lives to like help other people's lives. And then what I learned from this also is like personally for me with like the actual class is that it's definitely stressful to figure out all like the time zones and everything and figure out everything, but it was also exciting to see everything, and I was very happy to work with everybody as well.
Lastly, Minchi, what are your takeaways? What did you learn from this?
Yeah, I had the opportunity to like really to learn about how they do pandemic prevention and control and how they feel about it. And I think that every doctors, every healthcare workers all around the world should be respected, really, because they are risking their life to save people. And yeah, they suffered a lot. And I have the opportunity to know about other countries' position, and yeah, that's really helpful.
It's so happy to see that all of us learned something or the other through this research that we did not expect to learn. That's a great thing. Lastly, I am grateful for you guys for helping out with the research project. There were clashes between time, there were miscommunication, but I'm so grateful that all of us went through it. I'm also grateful for our faculty members who actually guided us through all of this. It would have not been possible without their guidance. Thank you, guys.
Thank you.
Thank you so much.
Thank you.